On July 1st, a new California law is going to come into effect that's going to require students in grades 7 through 12 entering school in the fall to have proof that they have had a Tdap or Pertussis booster. When I say Pertussis, that is whooping cough. So this fall, students entering the 7th through the 12th grades in LA will be required to have proof that they have had a booster for Pertussis. Now, you probably are aware that we're in the middle of a very substantial pertussis epidemic. In fact, if you look, we have more cases now than we have ever had since 1947. Last year, there were approximately 8,000 cases in California. Again, we have not had so many cases since 1947. And we had a substantial number in LA County, and we had 4 deaths, all in infants, which is much more than we normally have, and every one, of course, is tragic. This epidemic is ongoing, and therefore it's very important that all adolescents who have not yet been immunized get immunized and not wait. Why wait for the line at the doctor's office before the fall? Why not get the vaccination now? Preteens and teens that in fact get pertussis, this whooping cough, can be very ill, not generally as severely ill as infants, but can have very sustained cough up to 10 weeks or more. Sometimes they need hospitalization. They definitely can miss substantial amounts of school, and during that period of time that they have this cough, they are very contagious. Most adolescents receive vaccines to protect them from pertussis when they were infants and very young children, but this vaccine's effectiveness fades during late childhood through adolescence and into adulthood. So it's really important to boost your immunity in this critical period, and that's why next year every child entering the 7th through the 12th grade will be required to show proof that they have gotten a Tdap booster. That's against whooping cough particularly, but also against diphtheria and tetanus. It's particularly important that anybody who's going to be in contact with a very young child be adequately immunized, because those infants that are under 6 months of age and in which we've had all the deaths are not fully immunized. So it's critical that anybody who is caring for them, whether an adolescent or an adult, be immunized fully before they have any contact with these children. It is also important that children during this period of time in the 7th, 8th grade window, it's also important that children at this age be immunized against meningococcal disease. And that's also a very serious disease, and we recommend that that be undertaken as a vaccine around age 11 and 12, and we know that that's particularly important at that age. People should see their own doctor. The doctor will give you both your pertussis vaccine, your Tdap, and your meningococcal vaccine. There are about a third of children who have not gotten a meningococcal vaccine, and if you look over there, you want to look at the percentage of 13 to 17-year-olds who have received their Tdap vaccine. Unfortunately, there's about half of children in that age group, as of last count, who had not received their Tdap. So it is particularly important. And you can see that who gets Tdap, they're first of all routinely recommended for infants and children at 2 months, 4 months, 6 months, 15 to 18 months, and 4 to 6 years of age. That's the early childhood vaccination schedule. But then they're also recommended for children between the ages of 11 and 18, preferably at ages 11 and 12 years of age, and any adult who has not yet received a Tdap dose. So after this next year, there will be a requirement to show you've had the Tdap booster for every student entering the 7th grade, because we will have already covered the other grades. But the time to do it is now. It's very important, and this is a good way to preserve health in our community.